ನಮಸ್ಕಾರ, ನ್ಯೂಸ್ 26ಗೆ ಸ್ವಾಗತ. ಪುಟ್ಟ ಹೃದಯ ಅಪ್ರತಿಮ ಹೋರಾಟ. ಕೇವಲ 1 ವರ್ಷದ ಪುಟಾಣಿಗೆ ಹೊಸ ಹೃದಯ ಮತ್ತು ಜೀವನ. ಇದು ನಾರಾಯಣ ಹೆಲ್ತ್ ಸಿಟಿ ಸಾಧನೆ. ದೇಶದಲ್ಲೇ ಮೊಟ್ಟ ಮೊದಲ ವಿಕ್ರಮ. ನಾರಾಯಣ ಹೆಲ್ತ್ ಸಿಟಿ ಕೇವಲ 14 ತಿಂಗಳ ಶಿಶುವಿನ ಹೃದಯ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನ ಯಶಸ್ವಿಯಾಗಿ ನೆರವೇರಿಸಿದೆ. ಇದು ಭಾರತದ ದೇಶದಲ್ಲೇ ಮೊಟ್ಟ ಮೊದಲ ಪ್ರಯೋಗವಾಗಿದೆ. ನಿರ್ಬಂಧಿತ ಕಾರ್ಡಿಯೋಮಯೋಪತಿಯಿಂದ ಹೃದಯ ವೈಫಲ್ಯದ ಅಂತಿಮ ಹಂತಕ್ಕೆ ಶಿಶು ತಲುಪಿತು ಮತ್ತು ಕ್ಷಣವೂ ಆರೋಗ್ಯ ಸ್ಥಿತಿ ಗಂಭೀರವಾಗ್ತಿತ್ತು. ಇದೀಗ ಆರೋಗ್ಯದಿಂದಿರುವ ಪುಟಾಣಿ ಹೃದಯ ಕಸಿ ಮಾಡಿಸಿಕೊಂಡ ಭಾರತದ ಮೊದಲ ಅತಿ ಕಿರಿಯ ಚಿನ್ವ ಎಂಬ ಹಿರಿಮೆಗೆ ಈ ಮಗು ಪಾತ್ರವಾಗಿದೆ.
And Dr. Arjun Alva, who is the Director, Intensive Care Services.
So our child was a 10-month-old baby who again had all the features of what we call end-stage heart failure, where the heart muscle was not working. The baby had fluid build up all over the body, in the lungs, in the stomach, and everywhere. And there are no medicines to treat this, and this is what we have to tell or talk to the parent to see.
Differences from adults. One is, there are two types essentially that you get to do transplants in children. One are normal anatomy, normal structure and muscle failure. This is one of those where what you call as cardiomyopathy. Cardiomyopathy is an equal opportunity disease. It affects all ages, all genders, all geographies, etc. So this baby had what is called cardiomyopathy, which affects the...
So heart failure essentially means inability of the heart to pump enough blood to the body. It's an important cause of disease as well as death, both in children and adults. As the heart failure progresses, whatever medicines or procedures or surgery what we can do to maintain stable health doesn't work. So then what we call as advanced heart failure, which progresses to end stage heart failure. One of the key treatments for end stage heart failure is heart transplant, which can be life saving. Generally, once we reach the stage of advanced or end stage heart failure, the chances of death within 6 months is almost 50%. So generally, if you follow a set of patients over 1 to 1.5 years, most of them would have been died despite all the treatments. So unless you change the course of the treatment, we can't alter the disease.
The heart transplant program at our hospital. I'd like to just give you a flashback saying how this entire process started. It was on the 3rd of December 1967 when Professor Christian Barnard did the very first heart transplant. Now, apart from being a milestone for all of us, the important thing was that a heart transplant was made possible. This set the stage for all that has been achieved till now. Every organization that goes through the transplant process acknowledges that this was an event that benchmarked the beginning of the heart transplant program. Of course, it was done in the Roadshoe Hospital, Cape Town in South Africa, and the recipient lived for almost 18 days before he succumbed due to pneumonia.
Which has been performed at the Narayana Institute of Cardiac Sciences, Bomasandra. One of the key goals of Narayana Institute of Cardiac Sciences is to include every young patient in the transplant program and also make it a comprehensive program to include patients of all age as far as the transplant program is concerned. I'd like to introduce the panel members here and would like to call them on stage one after the other. Firstly, Dr. Julius Punan, who is the Director of Advanced Cardiopulmonary Therapeutics and Senior Consultant, Cardiac Transplants.
What a heart failure means, on the top left, if you see the video, that is a normal person's heart, where it is pumping, contracting just fine. And if you see the right lower corner, that is where the pump is only 15%. It's barely moving. And there is a variety of grades or stages of heart failure, and this is not only by the pumping fraction, but we take a combination of factors. But the unique aspects of heart failure or transplant in children is you can see a child sitting in front of you with the 10% pumping. The parents would not know, nor anybody else. The child would be talking to you. We recently had a child who attended a wedding, flew from Rajasthan, came to the OPD with some symptoms. When we did the echo, the pumping was only 10%. Nobody would know until you do the test. You will not see an adult with the same problem because adults will have symptoms much before the pump gets weak to 10-15%. So there are some unique features of how children behave versus how an adult behaves.
My hand and leg both are shaking before that. So yeah, it is very difficult. So it was very difficult time for us when we came to know that our child had this kind of issue, and I know no parents want to hurt this thing. But nothing is in our hand. Luckily, we got such a group of people where we came to know that in Narayana Institute, we at least we have a hope that our child may going to survive. So the end result is in front of you all that the operation was successful and our child is with us.
As I said, he's got a bad throat, and Dr. Kumaran, they are the ones who performed the operation in reality. In treatment of heart failure, you start off with medical treatment. Medical treatment aims at either reversing the disease process or postponing the transplant. We have very eminent physicians who are specially trained in heart failure and transplant. You already met Shashi, and on the adult side we have Dr. Bhagirath and Dr. Aditi, who are also Aditi. Please, that's Dr. Aditi. She's also trained and certified heart failure cardiologist.
So for the very first time we came to know 1 year back that, like, after having one test, and that was echo. So from the echo we came to know that the
After the photo session, we will leave the floor
1 minute, sir.
for all the questions.
Hello, sir. No, it is. Okay, start. Pehle se.
from the starting. So from the this was started a year back. So there was a test which was echo. So basically
the proper recipient because of the size differences and also the availability of the organ. So once both of them are possible, then the entire process can be done. The ischemic time is generally about 4 hours for an adult heart, whereas in children it can go up to 5 hours. So that gives us a little more flexibility in terms of getting organs that are slightly in more distant areas like tier 2 and tier 3 cities. Once this is available, then the entire transplant program is done. For the parent as well as the child, this is indeed a miracle, because getting a patient with heart failure of that size and getting a heart transplant done, and then the child is absolutely normal after that, I think this is one of the miracles of modern medicine.
The titling is there.
Okay. My name is Dr. Yan Shetty. I work in Narayana Health in Hosur Road. I am the director for the pediatric intensive care. This baby was admitted under us even before the transplant, when the baby was waiting for a heart. Once we got the news, we got him ready, and after the operation, generally after a heart transplant, our role in intensive care is to make sure that we treat the patient. We generally after a heart transplant, the heart goes weak because there is an ischemic time, and during that time we support the heart. We leave the baby in the ventilator, and also after the heart transplant we'll have to suppress their immune system by immunosuppressive drugs. That makes them more prone to infections. So we have to take good care, and once the heart gets back its function, we slowly have to take the baby out of the ventilator and take out the medications which are supporting the heart, slowly transit the baby out of the ICU, these are very challenging even in an adult. So for us it was a unique challenge. Even though we look after the highest number of children after heart surgery, this is a little different after heart transplant, and we knew the gravity of the situation because this heart has been donated by another child, and it is, for us, a heart is very precious, and it's not easy to get a heart and transplant a heart on a 1-year-old. So it was very challenging for the whole team. I would like to specially mention that this wouldn't have been possible without the nurses, the respiratory therapist, the physiotherapist, the dietitians, the pharmacist, and there are many more other support staff which help us in getting this child through. It was challenging. It's not something that we don't do day to day, but it is a little unique.
Thank you, sir. Thank you. Like our child was having cough and all those things. So because of that, we visited to that particular center. So the doctor suggested that there are chances that because of the heart, he is having some other kind of issues. So he suggested us to have the echo test. So after the echo was done, from there we came to know that the child is having a serious issue, and they told us that the child had a RCM, restrictive cardiomyopathy, and he suggested us to directly go to the Narayana hospital and no other way, because only the cure which is possible for such kind of issue is only be done in the Narayana hospital. So we came to the hospital. We talked to Dr. Sasiraj sir, and he told us all the possibilities, like what can be done pre-operation, post-operation, all those things he informed us and he told us. So like before the transplant, it was very difficult and tough time. I hope you also feel the thing which I was going on. So yeah, it was very difficult and tough time for us. So after the transplant was done, so the NH person, like the who are directly involved or indirectly involved, they handle all those things very easily, and they are humble all the time. Whatever doubt we had after the transplant as well, they told us like beat and everything very clearly and properly. So after the after the 1 month or 2 months, when everything was went well, they told we asked them to please release us to go to home so that we can take care for the baby very well. So after the discharge, believe me, like when we were in the hospital, like we were not that much of you can say problem or all those things, because we have all the doctors of team over there. But after the discharge, it was very difficult for us, like me and my wife, only we were are there for baby to be taken care of. So it is very difficult for us to take care of the baby and all. So as of now, the baby is good, everything is going well. He is good, he is responsive as well. So and extremely I'm glad for the Narayana hospital for having such good team. And because of that, as I have mentioned, that because of them only the child is with us.
Thank you. Thank you.
Thank you. Thank you.
ಇದಾಗಿತ್ತು ಇವತ್ತಿನ ಲೇಟೆಸ್ಟ್ ನ್ಯೂಸ್ ಅಪ್ಡೇಟ್ಸ್. ಇನ್ನಷ್ಟು ಸುದ್ದಿಗಾಗಿ ನೋಡ್ತಾ ಇರಿ ನ್ಯೂಸ್ 26 ಕನ್ನಡ. ನಾವು ನಿಮ್ಮೊಂದಿಗೆ.